Hi, my name's Don. I'm an ADN student with College of Central Florida. Today's patient is going to need tracheostomy care. I'm going to do a dressing change, and I want to clean around that stoma site. This is normal nursing interventions and does not require a doctor's order. I've knocked on the door. I've introduced myself to the patient. I verified the patient's identity through his name, first, last, and date of birth. He was able to confirm. We've established a distress signal that if at any point he needs this procedure to stop, he can raise his left hand. I've explained the procedure to him and provided patient privacy. I've washed my hands and I've gathered some supplies. I have a clean, new tracheostomy care tray. I have some clean gloves, a drape, normal saline unopened, and hydrogen peroxide unopened. After I open these, I'll date and initial them. I'm wearing PPE in case of any secretions, and I also have a drape that I can place over the patient. And the bed's at a good height for me, for my body mechanics. I'm able to monitor his pulse ox, and his vital signs are on our monitor. And he was recently suctioned, so his lung sounds very clear right now. His tracheal sounds very clear. So I'll begin the procedure. With clean gloves, I'll remove the old dressing. And as I remove the old dressing, I want to very carefully pull it out, and I'll examine it for color, odor, consistency, and amount of drainage, and I'll chart that at the end as I document it. At this point, I can wash my hands again, dry them, and I'm ready to open up my trach care tray. As I open this up, I see I have a sterile field. I'm going to be careful only to touch the shiny side and the outer parameters of this field as I place it. Okay. Now, carefully reaching into the tray. Before I use these sterile gloves, I'm going to fill 3 trays with normal saline. And then with my hydrogen peroxide, I just want to do a 50-50 mixture in this largest tray. Ready to begin the procedure. Find my sterile gloves. And set this aside. I have a couple of clean pipe cleaners to use later. Okay, so at this point I'll use my left dominant hand. Mr. Smythe, I'm going to remove your inner trachea cannula very gently. Okay. Now I'm going to place that into the 50-50 mixture with the hydrogen peroxide. Now, with my sterile hand, I'll agitate the 50-50 mixture. I'll let that soak for approximately a minute. I can retrieve the inner cannula and begin to clean it. Once the inner cannula is clean, we're going to place it into a normal saline canister to let it soak and rinse. Retrieving it, I'll use the pipe cleaners to help dry. Placing the inner cannula. Until it makes a clicking sound, and it's back into position. Turning the oxygen to the patient. At this point, I'm ready to clean the site around the stoma. I use my sterile hand. We want to work from inner closer to the stoma and away. Very good. There was no residual secretions and it came clean very easily. I'm going to replace my new dressing. If I need to, I can remove the patient's pillow, and at this point, it's a clean procedure to provide better access to the patient's stoma site. The kit comes with a pair of tweezers that may assist in placing the new dressing. Very good. I have new ties, which I place the new ties on the patient's stoma site behind his neck, and I would secure the new ties before removing the old. At that point, I could lower the patient down. I continue to monitor his respirations and respiratory status, his pulse ox, and I would want to document the procedure. Here you go, Mr. Smythe. Make sure the call button's in his reach, and with the bed low, and if he has any other questions or concerns, he's fine. Then I can clean up my kit and move on to the next patient. Thank you.